Rabies is another viral disease. It is acute, usually fatal. Sometimes we can say it's always fatal disease of warm-blooded animals that attacks the central nervous system. How it is spread? It's spread by the contact with an infected animal saliva, usually from a bite. The rhabdovirus that causes this disease spreads along nerve tissue from the wound to the brain. Symptoms usually appear 4 to 6 weeks later, often beginning with irritability and aggressiveness. Wild animals lose their fear of humans and are easily provoked to bite as pets. Rabies is widely distributed across the globe. More than 55,000 people die of rabies each year. About 95% of human deaths occur in Asia and Africa. Most human deaths follow a bite from an infected dog. Between 30 to 60 of the victims of dog bites are children under the age of 15. Lassa virus, genus prototype, single-stranded, negative sense, non-segmented RNA. 7 rabies groups in genus. Classic rabies virus, common rabies, 6 other with less than 10 reported human cases of disease. Rabies ranked number 10 worldwide as a cause of mortality. That is why it is an important disease, because it is usually, nearly all the time, it's a fatal disease. The incubation period in human average 4 to 6 weeks, but range from 5 days to more than 1 year. Incubation period up to 6 years have been confirmed by antigenic typing and nucleotide sequencing of the strain. Epidemiology: dogs, less than 5% of animal cases in USA, Canada and Europe, greater than 90 of animal cases in developing countries. يعني هنا بالعراق عندنا هالقضية more than 90% of animal cases. Very rare documented rabies in squirrels, hamsters, guinea pigs, gerbils, rats, mice, domesticated rabbit, and other small rodent. Almost never requires post-exposure prophylaxis. Wound cleansing and immunization done as soon as possible after suspect contact with an animal and following WHO recommendation can prevent the onset of rabies in virtually 100% of exposures. Wound cleansing and immunization. Once the signs and symptoms of rabies start to appear, there is no treatment and the disease is almost always fatal. The signs and symptoms of rabies. The first symptoms of rabies may be very similar to those of the flu, including general weakness or discomfort, fever, headache. These symptoms may last for days. So, rabies, to start with, it's a flu-like disease. There may be discomfort or prickling or itching sensation at the site of bite, progressing within days to symptoms of cerebral dysfunction, anxiety, confusion, agitation. As the disease progresses, the person may experience delirium, abnormal behavior, hallucinations, and insomnia. The acute period of the disease typically ends after 2 to 10 days. Transmission: saliva through bite of an rabid animal or is most common. لعاب من كلب مسعور، حيوان مسعور يعبر through skin، أو aerosolized in bat caves بالإيرو يعني Air. Mucous membrane transmission also reported. Bites and scratches. Risk of developing rabies dependent on the location of injury, depth and number of bites. يعني احتمال حدوث الريبيز يعتمد على عمق العضة والجرح، المكان الجرح والعضة، وعدد العضات. هم أكثر ريسكي في عالم على اختطار people who are the most at risk of rabies, those who are living in the rural areas of Africa and Asia, مناطق الريف. An estimated 31,000 people die from dog rabies in Asia each year. In Africa, death 24,000. Dog rabies is responsible for more than 14 million courses of post-exposure treatment to prevent the onset of disease. معناها شنو؟ يعني 14 مليون واحد ينعض وياخذ علاج. أهم موضوع بالقضية هو البريفنشن، disease prevention، لأنه قلنا 14 مليون ينعضون ويحتاجون لقاح، يحتاجون immunoglobulin وما إلى ذلك وكير. حتى نخلص من الموضوع we have to prevent the disease. أولا لأنه fatal disease إذا بدأ، ثانيا هو cost benefit جانب اقتصادي. Disease prevention include administration of both passive antibody through an injection of human immune globulin and a round of injections with rabies vaccine. Once a person begins to exhibit signs of the disease, survival يعني نادرا ما يبقى حيا. To date, less than 10 documented cases of human survival from clinical rabies have been reported, and only 2 have not had a history of pre or post exposure prophylaxis. Dogs are the main origin of rabies in developing countries, but other important host animals are the wolf and the bat. Most deaths from rabies in the United States result from bat bite. عضة الخفافيش. People who work frequently brings them in contact with animals are also considered to be of high risk than the general population. This group includes those in the fields of veterinary medicine, animal control, wildlife work, and laboratory work involving live rabies virus. يعني بالمختبر اللي يشتغلون باللايف فيروس of rabies هم ذول at risk. People in these occupations and residents of or travelers to areas where rabies is a widespread problem should consider being immunized. فإذا يجب أن نلقحهم ذول الناس. شلون نعالج؟ Because of the extremely serious nature of the rabies infection, the need for rabies immunization should be carefully considered for anyone who has been bitten by an animal, based on a personal history and results of diagnostic tests. If necessary, treatment includes the following: the wound is washed thoroughly with medicinal soap، صابونة طبية غسله مي وصابون طبي. Deep puncture wounds should be flushed with catheter and soapy water. يعني إذا فتح اسمه نحط كاثيتر بمكان ونسوي فلاشينج، يعني صابون مع المي، يعني شلون solution. Unless absolutely necessary, a wound should not be sutured. ويجب أن لا نخيط. وصلنا الجرح شو نحتاج نعطي تيتانوس توكسويد، لأنه هذا جرح عميق ممكن يعني يسوي تيتاني يعني قزيز. And antibiotics while should be administered. Rabies vaccination may or may not be given based on the available information. If the individual was bitten by a domestic animal and the animal was captured, the animal will be placed under observation in quarantine for 10 days If the animal does not develop rabies within 4 to 7 days, then no immunization are required. يعني عض الدوغ، خلي الدوغ ب10 أيام تحت المراقبة. إذا صار عنده sign symptoms إذن هذا should be treated. If the animal is suspected of being rabid, it is killed and then the brain is examined for evidence of rabies infection. كتلة وناخذ الدماغ ماله ونسوي له تحليل. In cases involving bites from domestic animals in which the animal is not available for examination, the decision for vaccination is made based on the prevalence of rabies within the region where the bite occurred. يعني إذا عضوا ما لقينا الحيوان، فإحنا إذا شفنا الإبيديميولوجي فاكتور موجود نبدأ نشتغل ننطيه. If the bite by a wild animal and the animal was captured, it is generally killed because the incubation period of rabies is unknown in most wild animals. Doesn't كتلة تاخذ دماغ. In those are rare instances in which rabies has progressed beyond the point where immunization should be effective, the patient is giving medications to prevent seizures. نعطي أدوية ضد الصرع، ضد relieve some of the anxiety and relieve painful muscle spasms. Pain relievers are also given. In other later stages, aggressive supportive care will be provided to maintain breathing and heart function. Survival is rare but can occur. Prognosis. If preventive treatment is sought promptly, rabies need not be fatal. Immunization is almost always effective if started within 2 days of the bite. Chance of effectiveness declines, however, the longer vaccine is put off. كل ما نتأخر بالفاكسين نخسر احتمالية الشفاء. Local treatment of the wound. Removing the rabies virus at the site of the infection by chemical or physical means is an effective means of protection. Therefore, prompt local treatment of all bite, wounds, and scratches that may be contaminated with rabies virus is important. فإذا مهم جدا نعقم وننظف المكان. Recommended first aid procedures include immediate and thorough flushing and washing of the wound for a minimum of 15 minutes with soap and water, detergent, povidone, iodine, or other substance that kill the rabies virus. Thank you.